practice, you have to try to understand the mindset of your population. You just cannot compare yourself with the rest of the doctors that he is charging so and so amount, so even I should go back and I should be charging so and so amount. No, you first try to understand what your population, how much they can afford to, and then you charge accordingly. You just cannot jump in and just charge them. No. Second thing is, you have to show them that whatever surgeries you are doing, it is you should be 100% sure, it should be quality oriented, and then you start charging them or demanding whatever amount you expect. Second is learning from the demographic and geographic map of the town. So this is I would give you an example from my side. Like, when I joined my father, we used to have an OPD of around 30 patients every day, and an IPD, a cataract surgery, of around 20 a month. So as from Arvind, we were used to seeing so many patients, and I had so much of time by the evening or afternoon. I used to sit with my receptionist, with the reception, with the logbook, and I got a map of my district and my taluka, and I used to pinpoint from which towns I don't get the patients. And then what I did was, I started giving visits to those towns, and that is how I started getting patients from those towns as well, because I had a good amount of time during that time, and that is how we could grow our practice. Now we see around 170 to 180 patients a day, and around 150 cataract surgeries a month. So getting into community by conducting school screening camps and camps for auto rickshawalas, this is a trick that I learned when I joined my practice. I used to conduct camps for the auto rickshawalas from this area, that area, and trust me, these are the people who are going to get you the patients. If supposedly if the patient is coming from the railway station or a state transport area, they are the people who will say, no, you go to this doctor, he is very good, and that is how you can publicize yourself. Then performing surgeries at a subsidized and free for the needy. So getting into private practice is not just about earning the money, but also giving back to your community. So see to it that you provide subsidized or do the surgeries for free to the needy ones. Because you never know, getting blessings are also equally important rather than getting just money. So growing practices, when you're doing this, you have to be physically and mentally fit, because you have to be able to handle the amount of stress. Because if you're into private practice, it is quite likely that once your practice grows, it is very difficult to handle this stress-like situation. So you should work out, you should be physically and mentally fit. Go to gym, do yoga, and also update yourself academically and surgically. So these are the few things that we brothers, we do present in most of the conferences. We do keep updated we read lot of journals. We go apply for fellowships abroad or in and around the country. We update ourselves with the latest technology, and that is how that will motivate you in sustaining your practice. So how do we sustain the growth? By learning from our mistakes and not repeating them. Do not repeat your mistake. The difference between a wise man and other person is, the wise man will learn from his mistake and will never repeat the mistake. And your life does not get better by chance, but it gets better by change, because change is the only thing that is constant. You have to upgrade yourself, learn a lot, keep learning every year, try to learn surgically or medically. Whatever new things come, try to incorporate that thing into your practice. And try to be patient. Everything will come to you in a right time, in a right moment, and be grateful. Don't be in a hurry just because some of your colleagues, they have been growing exponentially. That means that even you should be. No. Sometimes it will take some time for you, no matter what, but have some patience, because by the end it will happen good, and you will grow for sure. If you cannot handle stress, you cannot handle success. If you get irritated by small things in your OPD, it is very difficult for you that you are going to sustain the growth for a longer time. So you should be able to handle the stress, to handle the success. So as Dr. Abdul Kalam had said, to have a proper growth or to achieve something, have a great aim, continuously acquire knowledge, and there is no substitute to hard work. So to summarize, there is no shortcut to success. Hard work and have patience. Be smart while selecting a location and investing into your instruments. Build a good team, and your service should be patient centric and not a money centric. Be mentally and physically fit, and by providing service to your hometown people, patients, the level of satisfaction is enormous. I would request most of the postgraduates or most of the upcoming doctors to go and settle into the tier 3 town or a tier 3 town, tier 2 towns, or in your hometowns, because that will give you a different level of satisfaction, and you could achieve a lot. This is our team. This is with my father and my brother. This is the LASIK center. So we started with this hospital. This was the first photograph being taken in the 1997. This was what my father had built. This was a 4-bedded hospital. And when we joined our father, this is what we have built at the same place. So no goal is impossible provided your efforts are sincere and your thoughts are pure. And as Lord Buddha had said, if you light a lamp for the other, someone else, it will also brighten your path. I would like to acknowledge Dr. Sunil Kasbekar, Dr. Amit Mahajan, Dr. Jagdish Loya, and Dr. Anand Pimpalkar for helping us to